This is the Fertility Friday podcast, episode number 96. Welcome to the 96th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. I started this podcast because I believe that every woman has the right to know exactly how her body and her fertility works. I'm here to connect you with the tools and information that you need to improve your menstrual cycle health and fertility. And I feel so privileged to be able to share my passion for body literacy and fertility awareness with you every single week. Fertility awareness is so much more than just birth control or trying to get pregnant, because it truly gives you a window into your own health and fertility. And I love sharing my expertise with my clients and helping them to understand their charts and connect with their cycles. If you've recently discovered fertility awareness but you're not feeling confident about using it for birth control just yet, or if you've been charting for a while and you're having trouble making sense of what's happening in your cycle, I can help. Get started today with a free 15-minute consultation with me by heading over to fertilityfriday.com/coaching, or just click the Work With Me button on my website. And I would also like to invite you to sign up for the Fertility Friday newsletter. Head over to fertilityfriday.com/ebook, and as a gift to you, you'll receive a free copy of my new ebook where I reveal what to expect when coming off of hormonal contraceptives, and I share 5 steps to restoring healthy menstrual cycles post-pill. And in today's show, I'm very excited to welcome my guest, Mary Wong. Mary is a TCM, traditional Chinese medicine practitioner and acupuncturist. She's been in practice for over 20 years, and the vast majority of her patients have struggled with gynecological disorders, fertility challenges, and pregnancy-related symptoms. She's the author of Pathways to Pregnancy, Personal Stories and Practical Advice for Your Fertility Journey, which is actually going to be released around the time that we air this episode. Because this episode is airing on the 16th of September. That's around her release date, which is really convenient, just how it worked out. She is also the founder and CEO of Alive Holistic Health Clinic, which is located in downtown Toronto. And in this episode, we will be talking about Mary's new book, Pathways to Pregnancy. And we'll be talking about some of the issues that interfere with pregnancy and can cause fertility challenges, as well as the challenge for patients who've received a diagnosis of infertility, how to move forward in the face of such a daunting diagnosis. So without further ado, welcome to the show, Mary.
Thank you so much for having me, Lisa. I'm really glad to be here.
Well, thank you so much for coming on the show. And so I'd just love to start with, I gave a really short introduction to you and the work that you do, but I'd love for you to introduce yourself to the listeners and just talk a little bit about your background and what drew you into the field of TCM.
Well, I was veering towards going to medical school. And unfortunately or fortunately, I'm not sure which way to look at it, but in second year university, my grandmother fell ill. And to the point where they had diagnosed her with cancer, and then it wasn't cancer. Long and the short of it was they gave her like 2 weeks to live. And in that time, we thought, let's have her be comfortable and let's have her just be at home in her last days. Throughout that time, while we were at home, it was my brother who, picked up the Yellow Pages, which is like this resource book before Dr. Google came around. And we found a TCM practitioner, a traditional Chinese medical doctor. And I was the one who brought her downtown, and she was getting acupuncture, taking herbal medicine. And within 3 months, she fully recovered. She lived another 8 years, and she was 86 at the time to begin with. So she died at 94. And in that moment, I thought, oh my gosh, there's a huge hole. How can Western medicine just give up on her? And then with Eastern medicine, it brought her back to life. So during that summer, I made a pact with myself, and I said, I have to bring this to the world and allow people in North America to be able to have access to medicine that can help in, so many different ways. I finished my degree in biology and went off to Chinese Medicine College, and I haven't looked back.
Mm-hmm. Well, that's an incredible story. I think it's so interesting. I always ask my guests, or at least try to ask my guests, how they found themselves in the work that they do. And it's very interesting because a number of my guests have entered the work because of either a personal experience that they had where their health was kind of in peril, or a family member who experienced something And so it's really interesting how we kind of end up in the work that we do.
Chinese medicine is really an overall medicine, meaning we can treat a whole host of different things. The most famous thing being pain of any kind. Well, over the years, more and more, I saw lots of women and couples going through fertility challenges. So I saw people through their fertility challenges and then throughout their pregnancy. Basically, I would call it the whole women's life cycle. I had always looked at it upon where I had interest in fertility because I knew that I would kind of prolong my own personal fertility journey, just, living the life that I had. And when it came time to trying to have children at the age of 38, I never in a million years thought that my husband and I would have issues because both my grandparents had children at 46. And little did we know that I had issues. And it was a shock because I think like anyone going through this, you just think that when you want to have a child, it'll just happen. Because basically before then, as you're growing up as a teenager, you're like, the fear of God is put into you because you don't want to have teenage pregnancy, right? So you do everything in your power to try not to conceive. So when you want to conceive, you just think that it'll be that spontaneous. And unfortunately, 1 in 6, and myself as one of them, did not have that kind of easy journey.
In your book, you shared so candidly about your journey with your own fertility challenges. And I just wanted to ask a little bit just about, any woman who struggles with fertility challenges, no one thinks it's going to happen to them. But in your position as a traditional Chinese medicine doctor who has been treating women with fertility challenges for all these years, I can't imagine how that would have felt for you, because it's kind of like every woman thinks it could never happen to me, but you have all this knowledge and experience and wisdom. So I can't even imagine how you must have felt when it happened to you.
You're absolutely right. It was a huge shock, especially when I thought it was my husband. I was like blaming him because all along I'm thinking, okay, it's his lifestyle. He doesn't listen to me, even though I'm a practitioner. Maybe he should stop drinking all his beer because he's Belgian, right? And he loves his aperitif and then his wine for dinner. And it was a truly, truly an eye-opener when I was left with, oh my goodness, I cannot conceive. And the reason why I could not conceive was because of a very physical issue, and it's called hydrosalpinx, and that is blocked fallopian tubes. So to give you the gynecology 101, fallopian tubes extend out of the uterus, and there are finger-like projections so that when the egg drops down from the ovaries, it's like a catcher's mitt. They catch the egg so that it'll travel down and settle into the fallopian tube, where hopefully a sperm will be sitting there ready, waiting, and perched to pounce on this little egg to fertilize it. And then after like 3 days, it'll travel down into the uterus, where it'll eventually embed and hopefully plant and develop a baby. And so in my case, they were not only blocked, but they were also found fluid-filled. And the secondary part of this condition is that the fluid that is in the fallopian tube is considered toxic, if you will. So even if somehow, by some miracle, an egg can go through it or into it, the toxic fluid, so to speak, will prevent it from fertilizing and certainly prevent it from embedding into the uterine wall. It's interesting for me, and it was very humbling, because I've seen so many miracles through my practice. And this is the one thing that I would not be able to reverse, because I saw it on and witnessed it on the X-ray. Those little fallopian tubes were nowhere near normal looking. They were like completely tortuous and topsy-turvy. So I knew in that moment that, is at a point of no return, and that my eggs and my husband's sperm would never be able to meet up unless we used some great intervention. And it was really difficult to embrace that. But dropping my natural medicine self, I had to, because basically it's like I had to ask myself, do I want a child or not? And when I say, well, yes, I do want a child, then really the option, gratefully, now that I see it, is that I can embrace Western fertility and IVF. And as I told you from before, I was so disenchanted with the Western medical system when my grandmother fell through the cracks. And I had always looked upon my profession as, I want Western medicine to embrace Eastern medicine. It was a complete eye-opener and a huge turnaround for me to say, oh my goodness, part of my journey is to also embrace Western medicine. So how can Western medicine embrace Eastern medicine when I don't embrace Western medicine? So in a way, this journey had myself open up. And I'll tell you right now, at least in Toronto, all the fertility doctors know me, and we really work collaboratively. And we see how Eastern and Western medicine can really work together in unison for the greater good.
That's such a powerful story. And I appreciate you really going into kind of the emotional process that you had to go through, because, I get a lot of women who come to me and they'll say, I absolutely don't want to have to use IVF. I just want to, try learning more about my cycles because I teach fertility awareness charting. And so, I can obviously help women then to learn how to interpret their charts and identify their fertile window, and also pick up if there's anything on the chart that is kind of showing that there could be a problem. And so a lot of women kind of have that one or the other idea, right? Western medicine bad, alternative or natural medicine good. And so I think your story is so powerful because it really shows how they both have a very important role. And we are very fortunate to live in a time where we have the option to say, I want to search out natural routes, or I want to seek out medical assisted reproductive technology.
I completely agree. And again, I was in that place, right? It was all about natural. And when I found myself like, okay, no amount of natural is going to help me, so I better embrace it. Otherwise, I'll have to choose child-free or adoption. And yes, I did consider child-free. And in fact, my husband said, we have a good life, we travel, maybe this is just our journey. And in the end, to me, I thought, you know what? This is not the end of the road. I do want to experience being a parent. And looking at it from a more open perspective, what does being a parent mean? Well, being a parent doesn't necessarily mean that I have to conceive in the bedroom, just, him and I. Apparently, I had to do it in a lab and with a lot of assistance, not very sexy at all, but, it is what it is. And instead of focusing on the past of, oh my gosh, woe is me, I was just present to, the choices I can have to have me get there. And to the point where, in fact, even when the IVF wasn't working, and, you'll read about this in my book for those who will pick up my book, hopefully, I did multiple numbers of IVF cycles, and they did not turn out, unfortunately. Because of that, then I had to open up my world some more. It's like, well, can I consider adoption? Can I consider donor? And again, if you had asked me a year or two prior, I would say absolutely not. Great for others, definitely not me. And then to be in it, and over time, just opening my world up. And there's a saying my father has. It's called patience, perseverance, and persistence. And through patience, perseverance, persistence, I had to open up my world to different ways of having a child. So my husband and I did not just look at adoption, but we physically went through the process, which has a huge amount of challenges of its own, by the way. Having to do a home study that took, close to 9 months with a social worker who basically looked to see if you're fit as a parent, which is crazy because we're like this loving couple that want to have this baby. And normally if you try to spontaneously conceive, no one judges you and tests you to see if you're fit as a parent. And yet you go through this arduous journey for adoption process to see if you're fit. The other thing is that we had to take a mandatory program as well called PRIDE program, which is a Parent Resources for Information Development and Education. When we passed all the tests, and literally it took almost a year for all this, we were trying to adopt through China. And by that time, all of a sudden, China changed their policy and it became much more difficult to get a child from China. So, one might say, oh, if you can't conceive, just adopt. Well, just adopting is not just adopting. It's a huge, arduous process of itself. And because we were on the list for China and with no end in sight, that's when we went back and said, you know what? while we're sitting in queue, why don't we go back to IVF? And that's how we continued our journey. It's crazy, but this is what you do. And then while we're doing that, then it's like, well, we're open to adoption. If we do donor, which again, I was against for myself, looking at it through a different pair of eyes, then it was, wow, it's like adopting, but really, 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 really early on. And you have so much more control because you get to choose this donor, and you don't get to choose your adoptive baby, right? Mm-hmm. So you get to choose a donor, and like they give you a whole profile, and you get to have the baby in your belly and go through pregnancy. So all of a sudden, that didn't sound so bad. So here I was, initially wanting to conceive completely naturally, to then embracing adoption and IVF and donor. It was crazy times. So needless to say, at the very end, we were very, very fortunate to have our child, Zoe, who is now 4.5 years old. But it was a 6-year journey. It was through IVF, and she was a frozen embryo. And to this day, as a 4.5-year-old, I have to say, my daughter loves ice.
That's awesome.
I don't know if it has anything to do with being a frozen embryo, but there you have it.
Oh, that's amazing. Well, that's an incredible journey that you went through. And for the listeners who are listening for the first time, I recently released a podcast where we actually went through the donor egg process. I interviewed the CEO of Donor Egg Bank USA, and she gave a really thorough kind of breakdown of how the process works and egg freezing, egg donation. So if that's something that's interesting to you, I'll link that episode in the show notes. And, so to kind of switch gears a little bit, Mary, thank you so much for sharing your story. I think it's really the stories often that are the most helpful for listeners and so informative as well, because there's so many layers of your experience from the process of adoption, which you're right, that idea that, oh, well, you just adopt. But I also did an interview with Sheridan Voisey, and he wrote a book about his experience, him and his wife's experience, and they actually had a 10-year infertility journey. And the adoption process was a large part of it for them as well. And again, it wasn't this easy thing. And in the end, they weren't able to get a baby through adoption. And it was a lengthy process, just like you described. But, after having gone through this, so you were seeing patients for many years before you went through this experience yourself. And so after having gone through this, I'd love to hear how this experience has informed your practice and how you relate to your patients.
Well, as I say, I'm a practitioner and a patient, so I really get every nuance of this challenge. We come at it, and all of us, all of our clinicians at Alive Holistic Health, we come at it with a very empathetic set of eyes and are really able to sit with patients. And unfortunately, if people do go down the route of IVF or any other technology, what happens is you kind of get run through the mill because the clinics are just really busy. So there's no time for empathy. So really what I've always said to patients is, you go in there, you get the technology that you need, and you get out. It's not a place for hand-holding. If you want hand-holding, you go somewhere else. And the other piece I tell people is that, they say it takes a village to raise a child. Well, in my books and in our practice, we say it takes a village to create a child. So we are part of that village, and we're always there to help people and guiding them, not just through the TCM, not just by doing the acupuncture or giving people preconception advice into health, even more than that. And because, navigating through fertility world is like really difficult, to get up and go to those clinical appointments on a daily basis and how to navigate that and simultaneously have a job. Well, that's something of its own. And you already may know this, but perhaps some of your listeners do not. The stress of going through fertility challenges is that and equal to of someone going through cancer or having a cancer diagnosis. And I'm going to add to it that in one way, there's less support in in having infertility, because truly, like when people have cancer, other people know about it, and definitely everyone is supportive, right? But when it comes to having fertility challenges and having a diagnosis of infertility, there's a certain shame, there's a certain silence. People want it to be kept private. A lot of our patients, they don't even tell their own family members or friends. And that's not to say all, but a lot of them keep it truly between them and their partners. And for some, we have some single women doing it there on their own too. So it can be a really, really hard process. And we want to be able to guide them every step of the way and how to navigate it from their day to day. Does that make sense?
It does. And, this brings me to one of the topics that you really addressed in your book that I wanted to talk to you about today. And I just wanted to read a short excerpt, actually. I won't read the whole thing because I think I made this whole big quote, but this just in respect to when patients see a doctor and the doctor gives them a diagnosis or tells them, with certainty what it is that they're struggling with. So in your book, you say, many patients believe a doctor's words are the absolute truth, but that diagnosis represents a particular doctor's beliefs and theories based on experience, statistics, and research. Without intending to discount these, any doctor's knowledge of research can be outdated and their experiences necessarily confined to their own practice. So I just wanted to comment on that because one of the challenges that I face when in my own personal life, actually, as well as with women that I work with, is when your doctor tells you something, because doctors say things in very authoritative manner as well. So, for example, if they recommend a specific course of treatment, so they tell you that IVF is the only option and you're 35 or you're 32, and they're basing that on their own experience, and maybe they, you know what I mean? Maybe they've done some testing, maybe they haven't, maybe they're basing it on your age and just their understanding of fertility. But when doctors make these types of statements about recommended course of treatment, it's hard as a patient not to take it as gospel. So would you be able to talk a little bit about the nocebo effect and just that powerful impact of a doctor's words?
That's a really great topic. So thank you for bringing that up. So, okay, let's just go back a little bit because I think many people understand or know of the terminology, the placebo effect, correct? So, for example, when a doctor gives a patient even a sugar pill and tells them to go home, take it, the chances are a lot of them will have this placebo positive effect where all of a sudden they have an instant cure, their headaches get relieved because the doctor says it's going to make them feel better. Well, now, going back to the fertility clinic, and I'll tell you, 99.9% of the time when you walk into a fertility clinic, you're not going to get good news. People often come in crying after the fertility doctor, especially those that come in on the same day. They'll say, I just went to the fertility doctor and they told me my eggs were old or my eggs are old and that my only chances of conceiving is really I have to do IVF right now. So when you walk away with that, nocebo means in Latin, I shall harm. And it can have a really powerful negative effect. So placebo effect is a positive effect. Well, these words can have a negative effect. And this negative effect can have an impact where your body, all the way down to the cellular level, can be affected negatively. And just so you know, your egg in your body is the largest cell of a woman's body. The sperm is the smallest cell in a man's body. But the environment in which your cells are bathed in can be impacted in its growth and its development. And when our cells, our eggs develop, it doesn't start out. So, okay, let me back up again. When the doctor says your eggs are old, I'm going to say that it's a little inaccurate. Inaccurate because your eggs start out as germ cells, meaning they're like inert. They're just sitting there waiting to come into fruition and develop into ovulating eggs. So when they say it's old, it's like maybe the body itself is old and it's sitting in a environment that is not quite right. But potentially you can develop your eggs into a better environment. So there's a research out there where they took menopausal ovaries from rats and they transplant them into young rats' bodies. And when they do that, they find that the menopausal ovaries, they'll start menstruating and having and developing eggs. So really, when you take it back to us, it's like, well, if we have our ovaries and we tune it up, do overhauls, perhaps then we can create eggs that are in better shape. So it doesn't mean that they have to just be old. Does that make sense?
Mm-hmm. Yeah, absolutely. And you talked about the philosophy of traditional Chinese medicine. And I really liked what you said. I'll just paraphrase, but you said something along the lines that we do learn, and I agree, that we learn to take better care of our cars. So we have an understanding that our cars need to be maintained, that we need to get regular oil changes. But for some reason in our bodies, we don't kind of have that same understanding. And so it makes perfect sense then that since the egg is in your body, your ovaries are part of your body, that if you take care of your body kind of overall, that you're going to have a better environment for your eggs to grow and flourish than if you're not taking care of your body.
That's right. And that is both, physically through movement, like exercise. So not too much, not too little, not being couch potato, but then not running a marathon when you're trying to conceive. That is about eating whole foods, real foods, and preferably foods that are grown within the area, and also preferably not having pesticide-ridden foods or hormone-laden foods, because that can all impact your overall well-being, never mind your reproductive organs. Even, in how you drink your water, like the bottled water that you get, if it gets exposed too much to sunlight, they start to break down. So to take care of a car, you're not just going to wash the outside and, give it a nice waxing. Like that's not going to do it. Like it looks good on the outside, but you actually have to go in and look at the engine and help and maintain that. So back to us, it's not like, oh, gee, just because you do a manicure and pedicure, that's not going to get your eggs healthier. Granted, it may make us feel better. So emotionally, if it makes us feel better, it can, in effect, help us down to our cellular level as well. But we have to literally physically do things too.
Along the same lines of that whole idea that our eggs are old and that we're aging, I get a lot of questions about test results. So when women go to the doctors and they get their FSH levels tested, follicle stimulating hormones, so basically how responsive are your ovaries? Your brain is telling your ovaries to ovulate. That's all that's testing. But also like low anti-Müllerian hormone. There's all these different tests that women get. Could you maybe talk a little bit about how, I guess, the concept of poor ovarian reserve, how it's tested for, and kind of what it means when you get those types of test results?
Yeah, absolutely. So poor ovarian reserve is really like a theoretical concept because it's considered to be a reflection of how poorly you have in the chances of conceiving naturally. And so when you get faced with poor ovarian reserve, in a medical perspective, your best chance is through going through like donor, and like every month is a race to menopause. So you better, do something right now. So you either do IVF right this second, or you go straight into a donor cycle because you'll just have more chances. Well, the reality is they base it on 3 markers in diagnosis. So as you had mentioned, one is high FSH. So basically when you have a blood work of FSH on day 3 above 10, automatically they say, oh, gee, this is poor ovarian reserve. However, they used to say you're as good as your highest FSH. But now we know that FSH literally can go up and down every day. So it's not the best marker. However, what it does tell you, though, if you do have a higher FSH, is that IVF won't really work for you. That's all it means. It doesn't mean that you cannot have a child. But IVF won't really work because the drugs that they use to stimulate more eggs is FSH. So if you already have high FSH, putting more FSH totally does not work. And then the other marker for diagnosis is anti-Müllerian hormone, which is AMH, also a through blood draw. They see that one now as the end-all be-all testing because that doesn't shift as much throughout your menstrual cycle. So dailies, so it doesn't matter when you take it in the cycle, they say it's pretty stable. So you should have a certain amount. And when there's too much, actually, if it's too high, then it's an indication for PCOS, polycystic ovarian syndrome, which is a whole other thing in of itself. We're addressing poor ovarian reserve. So low AMH, that's the other marker. But yet, I've seen women that had considered very low AMH and they still in the end had a spontaneous conception, or minimally with no drugs and doing IUI, but definitely not IVF because it just doesn't work. And the third marker is AFC, the antral follicle count, which is also seen on the third day of your menstrual cycle, seen through vaginal ultrasound. And what they do is through the ultrasound, they look at the ovaries, they see how many follicles are there. And there's one egg per follicle. So the eggs reside in follicles. And again, when they see the low numbers, they'll say, oh, gee, you're nearing menopause. So to address all of that, I agree it gives you a poorer chance, certainly for IVF. And I also agree that, yes, you will have a higher chance of conceiving if you do donor. However, what a woman hears automatically is that I will not be able to get pregnant by myself. And that is not true. It may be that the percentage chance per cycle is lowered and quite lowered at that. But that doesn't mean that there aren't things that you can do to help it. So, for example, going back to preconception health and preconception treatments. So things like, again, eating right, having a better emotional status, keeping your body both physically, mentally, emotionally more well-balanced can prepare you to receive life in a more optimized way. You had a speaker that was there, Daniela De Rosa. It was a great interview, but there was one thing that stuck to me because she talked about breaking down a wall, like a barrier. And how I see fertility, I don't look at it as that. In fact, I look at it as the opposite. And I always invite patients to look at it this way with me, because when we struggle through fertility, it's as if we're like climbing Mount Everest. It's like this torturous climb, and it's really hard. And the whole point of then coming in to see me is, let's find other ways to have your body be more receptive, be more optimized to producing a healthier egg. And what that looks like to me is, what? Can you consider that maybe you're not climbing up this Mount Everest, or maybe you're not having to break down any wall, but consider that your body is actually a valley. And a valley is such that it's a place where you receive life. So can you look at how we nurture this valley to allow it to be more spontaneously able to conceive life? Sometimes it does require some assistance. And other times it just allows you to look in your life and, alter the way of being, not looking at it from a place of this is hard and this is work, but really like just looking at it from a perspective of, wow, I'm being really nourishing to my body, my mind, my soul, my emotions, and that decreasing that stress and, not having your adrenals be overtaxed day in, day out through this fertility process and life itself, perhaps then our bodies will be in better alignment. So the other example I always use is, when we are fighting for our lives or when we're struggling with fertility, it's as if we are being chased by a lion. So in the wild, when a lion chases an animal, they just do not go into heat because guess what? They're in survival mode. There's no amount of reproducing going on, right? Because that's a threat to life. So it's like, okay, well, how do we, the lines are out there. Your lines of trying to get pregnant are out there. So how do we receive our body so that it's not being chased? Because if it's being chased, it's just protecting. It's in the body's loving way of saying, you know what, not right now. You can do whatever the heck you want, but not right now. So going back to, having the doctor scare you, you're not in a place of receptivity. So in my book, I draw upon 15 stories of hope. And some of these are really, they have like major challenges. And some of the cases that I discuss, they ultimately still conceive babies on their own naturally by doing lifestyle dietary things, herbal medicine, acupuncture, those kinds of more natural things, even after they have done IVF or donor, like that. Mm-hmm. So, our bodies have a capacity to heal, and it's beyond diagnosis. So people with high FSH, low AMH, low antral follicle count know that these are markers. Markers are just markers, and it's a baseline. It's a starting point. It is truly not the be-all, end-all. It's not a prison sentence. There is, and trust that we have the capacity to heal.
Well, I imagine for many women who are struggling with infertility, who have done their research, spoken to different practitioners, it's probably pretty annoying to hear, just relax, stress is such a big part of it. And except that one of the things that I have seen firsthand with the women who I work with is how surprised they often are at how significantly stress can impact their menstrual cycle, for example. So I regularly have conversations with my clients when their cycles are, they'll email me, my clients, I'll get an email from a client saying, my cycle is never this long and I don't understand why, this happened this month. And then, in our session together, I'll say, okay, so what was going on this month? Oh, well, I was traveling, I went, to 3 different states over, 3 days. And then, my friend lost his job and I had to support him in moving here. And all of a sudden, all of this, it's like the stress falls out of the backpack, right? Like just bricks and bricks of stressful things on your body. And it's exactly right around the time that you see the cycle abnormality. So I think one of the things that, we're sick of hearing, relax, but also surprised to see how significantly stress can actually impact our health. And so in your book, you talk about some of the practical ways that you work with clients to reduce their stress. And I'd love for you to talk about some of those kind of practical hands-on ways that we can all work towards reducing our stress and kind of being a little bit more mindful in our day-to-day lives.
Yeah, it is very true. Our menstrual cycles for a lot of women do get impacted by our day-to-day stress. And you are hands down right. I hated it when people said it to me. It's like, just relax, you'll get pregnant. Well, first of all, I have blocked tubes, so no amount of relaxation would help me anyway. But that's besides the point, because that's a whole other story. So anyone else not having blocked tubes will still get the same. And yeah, you just want to punch them in the face, I have to say. But yet simultaneously, there is a huge truth in it. And it's not just by relaxing that will help you, because it's really a matter of managing the stress. So for example, and I'm going to say this too, in fact, on the weekend, I had a lady that came over for a barbecue, and she is 35. She just had her first baby. And she told me, while you're in the Toronto area, so there's a local hospital called Sunnybrook Hospital. She gave birth there, and that's where I gave birth to our daughter, by the way. And what came out was that the nurse told her that, the average age of first-time baby is 35 years old. So I know that going in, basically all around the world, we have an increase of age, right, as we try to conceive for the first time. And what comes with that is, guess what? When you're a little older, you have more responsibility, you have a job to hold down, and also you may have aging parents. So it is so common for me to have women and couples trying to conceive, and spontaneously I hear that they're like being their primary caretaker for their mother who's got cancer, or someone's dying. So there's a lot of stress. And these kinds of stress, it's not like you can just take it away or say, sorry, mom, I'm not going to be with you because I'm just trying to have a kid, right? That's just not going to happen. It's not feasible. So when I counsel people, it's like, yes, look into your life. And if there are certain things of stress that can alter, like even in the workplace. So, can you maybe work from home once a week? And for some of them, they can. So great. That's one way of decreasing stress. So looking into your workplace. But then there are things that you just cannot get rid of. Like I say, the aging or the ill parent or a cousin, what have you. And these are things that you just have to deal with in life. So having these stresses in life, how do we be? So one of the things that women ask me every single day is, well, what more can I do to conceive? Well, I always go back and say, well, perhaps look at what one way or what one thing can you let go of today? So it's not as much a way of doing, because I'll tell you, most women going through fertility are doing a hell of a lot. They're like really doing everything. And so it's a matter of how in the way of being that has you be more relaxed and less tense. And some of the things that you can do on your own would be even like finding meditation recordings, because, you know, if you're a really busy woman, you don't have extra time in your day to add in meditation. So I say, well, there are walking meditations if you're walking to work, or if you're driving to work, there are like driving, commuting meditations. So listen to that. And basically what I request is that you're being in the moment, because one of the parts of stress is there's physical, but then there's the mental, emotional. Because our minds are churning, whether it's worrying about getting, you know, your job done at work, to strategizing different ways of getting pregnant. And the more you do that, the energy is all resting in your head. And what we want to do is shift that energy, because we only have so much energy in the body. And we know scientifically that energy is required to split those eggs to make them haploid, meaning that the chromosomes need to split in half but in order to meet with the sperm. And one of the things, back to the poor ovarian reserve thing, one of the problems with aging is that we say that chromosomally the eggs may not be quite right, meaning that the split off may not be even. So, well, if you go back to stress, if we can utilize some of that energy and allow it to go back down to our ovaries, maybe it has more energy to split those eggs appropriately, so there's no less chances of chromosomal abnormalities. So how do we have our minds be more at rest? Well, it's about being in the present. So things that you can do for yourself, which is different for everyone, by the way. What can you do? Look into your life. What can give you more peace? What can give you a bit of happiness, even if it's for that moment? It could be going for walks. For some, it could be like taking up pole dancing. I don't know, something, right? That gives you a little life, that can have you be in the present moment. Sometimes I ask people to practice gratitude. Online on Facebook right now, I'm doing a thing called 365 Days of Gratefulness Project, of keeping the grass greener on this side, I call it. Because when we have these arduous journeys, we can't help but think of the negative things, or, oh boy, I can't get pregnant, or how is this going to be, or man, I wish my husband can like be more supportive, or, you know, all this complaining that we do. So in practicing gratitude, being mindful of it at least once a day, it may help you to, you know, lessen that load a little bit. And again, even if for that moment, it can at least help your adrenals be a little less taxed, have your hypothalamus working a little better to send those messages appropriately down the cascade of hormones right down to your ovaries, so it can perhaps produce a better egg. And of course, just perhaps looking at changing your lifestyle in terms of exercise and eating whole foods, that in a way can make you feel good. Now, Chinese medicine is all about balance. So I always say it's not necessarily about being anal with the food and exercise, but it's being in a way that you feel empowered. If you feel like, wow, I stopped coffee and I feel really awesome about it, then I say all the way, keep it that way. But if you're like a lover of coffee and, you know, normally you'll almost like orgasm with it, and you stop having coffee and you feel like you're totally deprived, then I say, you know, you might be a little off balance because emotionally you're feeling deprived. So guess what? Maybe you might want to allow yourself to have like a cup of organic coffee once a week, twice a week, and without guilt. Like, have it, sip it, close your eyes, make it like this meditative, orgasmic process where it in of itself can be therapeutic. Mm-hmm. So, you know, there's no definitive black and white cookie cutter method for all of this. It's really about being able to tap into your inner self and really trusting your gut. And that's hard to do when you've been going through fertility for a long time, right? Yeah. I know I witnessed that myself. And I'm one to claim that I tried everything. But at the end of the day, as the years went by, I kind of threw some of those things away, all those have-tos, and just paid more attention to, what causes me more inner peace. And that's the hardest to do because we live in a land of doing. So we think of doing will make us get to be pregnant faster versus being in the land of being. So again, back to just relax. There's something to that, but it's not just simply relaxing. It's really coming around into your inner wisdom, listening to yourself, do what feels right, and not letting doctors boss you around by telling you that you have to do IVF tomorrow. If you come to it, great, at your own time, when your body is surrendering to it, rather than doing an IVF when you're feeling desperate and fearful.
Oh, you touched on a couple points that I really liked when you talked about managing stress in your book. And you touched on that mindful eating, having the coffee and having that joyful experience if coffee is something that you really love. So what I liked about your stress management when you talked just about that, and it's not just one section, you kind of talk about it throughout the book, but it's being mindful of trying to because there's a difference between meditation and actually sitting down and sitting in silence and having that experience versus also trying to incorporate a mindfulness practice throughout your day and trying to enjoy those simple moments and be present in those simple moments. And so I really like the idea as well of when you sit down for a meal. Well, first of all, sit down for a meal. So
yeah,
I like that. Yeah. And then when you're sitting down, because that's an opportunity for you to, eat something that you enjoy, that brings you pleasure, and actually taste your food, eat slowly while sitting down. And that can be a mindfulness practice because you have to eat anyways. And so these are more practical ways of trying to build those things into your life, and they don't require additional time. They just require you to try to be present and to try to kind of enjoy what's happening now. And I think another thing that you said that I found also quite powerful, and I think it applies to every woman who's struggling with any type of fertility challenge, is that it kind of takes over your whole life. And you had mentioned in your book, trying to remember that like your life is not ending, it's not over, and that's not the only thing that's happening. And so trying to also live your life at the same time as when you're having this struggle, if what I'm saying makes sense. So whether that's, doing something that you enjoy, trying to incorporate some fun with your spouse. One of the things that I talk to with my clients, I think when women are able to chart their cycles with fertility awareness and they're able to pinpoint their fertile window, then they can really focus, on targeted timed sex on those days that they're fertile. But then you have the whole rest of your cycle where there's no pressure because you can't get pregnant. And so I always encourage my clients, take advantage of the periods of time when you're not fertile and just enjoy being intimate with your partner without having that sense of urgency and without him feeling like he's a sperm donor if you're partnered and you're in a relationship with a man.
Absolutely. And I'm going to add to that because people think of intimacy as just sex. Well, yes, that's nice. But really, intimacy is about having time together. And so for some, that intimate time is literally just spending time with each other. Like a lot of people don't even have that, right? With our jobs that are way beyond 9 to 5 these days, and where our jobs don't even match up with our spouses. And even holding hands. I have this thing with my husband. It's like, okay, we have to kiss each other, 10 kisses a day kind of thing, right? So just always keeping that love and that connection afloat, because unfortunately with the longer you go on the fertility journey, the less and less apt or likely that you even want to be intimate anymore, like sexually. So it's like, okay, well, how do we get intimacy back without necessarily having sex? right?
Well,
How
and
do you
you
get the
don't
love
want
back?
your partner to feel like a sperm donor. We often don't think of how
Mhm.
it can impact the male partner because it's predominantly women who struggle. And the fact that you even thought that it was your partner that you talked about when you were having your own fertility challenges, most women don't really go there unless they have kind of a push to do so. They always internalize it and think it's their fault. So we don't really think about the male partner. And does it feel like to know that your job is just to perform and, provide sperm, and that's all it is. And then you don't even get to enjoy the intimacy with your partner outside of those times. And,
Right. Yeah.
well, and along kind of talking about stress, and as we kind of come towards the end of our interview today, one of the things that you talked about as well in the book, because then you having numerous IVF cycles, you had to learn how to manage that 2-week period where after you've had the egg implanted, how do you actually live your life for those 2 weeks without driving yourself completely insane? And
Yeah.
I loved one of the things you talked about because it never really occurred to me, but after you said it, it made perfect sense. That fear that the egg might fall out. And kind of managing
that's
that.
The biggest one.
So I just love for you to talk about how you work with clients and patients to manage that 2-week wait period after they've had an IVF treatment.
Well, I actually wrote a huge 4,000 word thing all about the 2-week wait. And when I saw my editor, they cut it out. And I'm like, oh my gosh, you have to put it back in the book because really this is like the most important time because women drive themselves crazy, as you know, and as I know, and as anybody listening to this podcast will know. And how do you manage it, right? Rather than driving yourself crazy. Well, I dispel myths. So the myth is that the egg or sperm can fall out. And so when women are having sex, oftentimes they're like lifting their bums up in the air. Sure, that's nice, but really it actually doesn't do much. And so I need you to visualize that sperm can physically swim. And that's the whole point. Sperm has like these little tails. They look like tadpoles, and it can swim up within a matter of seconds right into the fallopian tube, sit ready, waiting and perched to fertilize the egg that's coming down after ovulation. So you can have sex standing up. You can do IUI and you are able to, get up. You can do IVF and you're able to get up. And then in terms of how much activity, how little activity, that kind of is personal dependent, because if you're a person that is a couch potato to begin with, you certainly don't want to be all of a sudden being so crazy active. And then for a person that is normally active, it's not about just sitting down and, having bed rest for 2 weeks. That doesn't work either. And in fact, there are studies that say that after an IVF, if you have 2 weeks of bed rest, it hinders blood flow. And you don't want that, because when the embryo implants into the uterus, it requires lots of blood flow, lots of volume of blood to keep it going, to keep it embedded. So little light walking is good. Laughter is excellent because it keeps your uterus nice and relaxed. And the one visual I always get women to think about is, think of a jam sandwich. Your uterus is not like this open vessel. It's literally like a collapsed balloon. But then this collapsed balloon, or what I call a sandwich, it doesn't fill up until a developing baby grows into it. So it grows as the baby grows. So visualize a jam sandwich. Your bread is the uterus, and then the jam is your uterine lining. It's sticky. So even when you move, things should not fall out over the 2 weeks. Is that enough?
That is amazing.
Is that a good closing?
That's fantastic. Well, I have a few questions to wrap up. And before I ask them, given our discussion today, what is one thing that you'd want our listeners to take away from this conversation?
Well, the very first thing that there is no shame. A lot of people go through this, and 1 in 6 have issues. And to add to this, 50% of the equation is the man. So even when it comes to a male factor fertility, oftentimes it's the women that still take the responsibility. So I just want you to put it back and say it's an issue that's for both both of us that we can help to address as a couple. And there are many proactive things that you can do. You are not your diagnosis. And we can overcome this issue by, looking at ways to help our egg development. And there is a possibility. And the one last thing I'll say is just be open-minded and keep yourself open to options that you first will not consider at all, because you never know where life will take you.
Mm-hmm. And what would you say is the biggest myth about fertility that you'd like to see corrected?
Well, the biggest myth, I think, is that, number one, the eggs are constantly old and just progressing down the path of that, menopause, like spontaneously. And the second myth is that it's a woman's problem, because it's not. It's equal men and women's issue.
Okay, and last question of the day. For a woman who is currently on the pill and she doesn't want to get pregnant now, but she is thinking about pregnancy within the next 2 to 3 years, what advice, if any, would you give to her?
Well, first is if you want to get pregnant, you want to look at your cycles now. So getting off the pill, finding other alternatives to regulate your cycle, because you want to see where you're at now. When you're on the pill, it masks what your natural body is doing. So you want to be in a place of being prepared. So when the time comes that you want to conceive, then your body will be that much more naturally receptive. So, being responsible and being proactive in your health overall and in your fertility health.
Okay. Well, wonderful words to end on. Mary, I just want to thank you so much for coming on the show today. I loved our conversation. I think the listeners are going to get a ton of information out of it. So I really appreciate you being here today.
Thank you so much for having me. And again, my book is called Pathways to Pregnancy, and really love for you to pick it up. There's lots of tidbits because it's 15 stories of hope. It's not just my own story. It's not all about me. And it is really wide and varied in terms of the conditions that are there. And again, how you can see how all of them can conceive one way or another. And, there's no one pathway, but there's one that may work for you. So I wish you all the best on your journey, and be well.
And where can our listeners find out more about you, your website information? Where can they pick up the book?
Oh, okay, great. So you can find me on www.marywong.life. You can pick up the book at any bookstore or on Amazon or Indigo or Shoppers Drug Mart, all of the above. And the last thing is that you can also find me on my Facebook page, Mary Wong RTCMP. And there I'm doing live feeds once a week that covers lots of different topics. And I also encourage people to ask questions, even if they private message me, if they don't want to be revealing themselves. But there's lots of blog posts and lots of information for you on your journey. And it's very practical advice that you can use.
Okay, perfect. Yes, so I will have all the links that you provided us on the show notes page for today's episode.
Thank you so much for having me on the show.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/96. I hope you enjoyed my interview today with Mary Wong. It was such a treat to be able to interview somebody who's local, who's also in the Toronto area. So often my guests are from all over the world, so it's really nice to be able to interview somebody locally. And I really did enjoy Mary's new book. So in preparation for the interview, I was able to delve into her book. And what I appreciated about it was that she wove in client stories with the information that she was sharing. So I found that it was a really readable book, and it really kind of gave the client experience and gave you kind of the background of the fertility struggles that some of her clients have faced, but she also weaves it in with her practical information and strategies. And so it's a great read. And if you were inspired by the conversation that we had today, definitely take a look. What I also loved about Mary's book was how she deconstructed that whole idea that we talked about in our interview today, which is the nocebo effect, and how powerful the words of your physician can be. And one of the things that I have found in my work with clients is just how important it is to reinforce the notion that you are the one who's in charge. I mean, your doctor plays an extremely important role, but your doctor is one person on your team, and you can enlist anybody on your team that you want. And so on your, health team, if you're trying to improve your fertility and your health, can be your doctor, but it can also be your fertility awareness instructor. You can also have your traditional Chinese medicine practitioner if you're doing acupuncture, or you can have your naturopath as part of your team. And you can even have a psychologist on your team, or you can have a yoga instructor on your team. But the point that I want to make is that you're the one that's ultimately in charge, and you're the one that has to make the decision. And I encourage my clients to really focus on what is the best decision for them, what resonates the most with them. It's possible that your doctor can make a suggestion and be quite adamant about their suggestion, and that still not necessarily be right for you. And so an example of that, is IVF. For some people, it's a no-go. They're not really open to that, and that's not the way that they want to go. And their doctor may be very adamant that that's the only option for them, but ultimately, you are the one that has to make that decision for yourself. And so I really liked what Mary and I talked about in our interview, which was that, when your doctor does testing and you get test results, they're markers. And they're really important markers that tell us what's happening, but they don't necessarily tell us the whole story. And your test results may be interpreted one way by your physician, and they might be interpreted another way by someone else on your team. So for example, a functional medicine practitioner. And so that's one of the things that I hope that you take away from our interview today. Remember, you're in charge. You are the captain of your own ship, and you're the one that has to make the decision about what resonates the most with you. And when your doctor or your practitioner or anybody on your team is making recommendations about what course of action to take, ultimately, you're the one that has to make that final decision. Because what I always say is that nobody cares more about your health and your fertility and your life than you do. And so just remember that you're in charge. You're the one. If you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. And make sure to head over to fertilityfriday.com and join my email list. If you have an idea for a podcast episode or guest suggestion, send me an email at info@fertilityfriday.com. Thank you so much for hanging out with me today. I appreciate all of you for taking the time to tune into the podcast, whether you're on the go or commuting to work. So thanks again. And as always, until next time, be well and happy charting.